Good afternoon. My name is Soo Kim from Yonsei University of College of Nursing. It is truly an honor to be able to participate in this session. You may have heard about the hereditary breast cancer. I'm going to talk about the building family future with hereditary breast cancer. The title of my presentation is like a river flows. There's no conflict of interest. We talk here about the gene running in the families. We're about being handed down, and Koreans do talk about this, and the people in the Switzerland talk about this. It's as if this is something that we cannot resist, but we are still being impacted by genes. And when we talk about hereditary breast cancer, we should think about in a broader context. We should think about this in the context of HBOC, which is hereditary breast ovarian cancer syndrome. And if so, this is when we do have a gene within the family that has a potential for breast cancer. And then there's a familial breast cancer. Even if you have cancer patients within the families, well, sometimes it is related to genes. However, the impact of genes on the incidence of cancer is quite low. And so there is technically a difference between hereditary breast cancer and a familial breast cancer. What you're looking at is a family tree. This shows the relationship to cancer. The ones in black are the family members with cancer. A circle represents women and square represents men. Here with the pink, this is a lady with the breast cancer. So she has genes for breast cancer, and she has a brother and also a sister with cancer, or a brother without cancer, and also another brother with cancer, and has a parent and also has children. She has 2 boys and 2 girls. And when we talk about genes within the family, we draw this family tree, and we think of the first degree relative and second degree relative and third degree relatives. And these concepts are used in order to presume whether it is HBOC, and this is relevant to both the maternal and the paternal side. We talk about the genes. In the past, we used to use the terms of mutations, but it has a negative connotation. So instead, we call this a pathogenic variant. These are the variants that may cause diseases. The ones that are famous are BRCA1, BRCA2, CHEK2, PAL2, and ATM. And with further researches, so now we see more and more genes being discovered. And this is high-risk groups. On the right-hand side, this shows the risk of hereditary cancer related to BRCA1 and 2. For the ovarian cancer, it's 10 to 15%. For the breast cancer, it's about 5 to 10%. It's not that high. So these are not these hereditary cancer is not very high. However, we still pay attention to these BRCA1 and BRCA2 because the incidence of the cancer do increase. For the female carriers in the general lifetime risk for breast cancer is about 3%, and sometimes as high as 10%. But for BRCA1 and BRCA2 programs, it goes as high as 85%, and there's a possibility of a contralateral breast cancer. And for the ovarian cancer, general lifetime risk is only about 1.4 to 1.5%. However, if a lady has a BRCA1 or BRCA2, then the risk goes up as high as 63% and 27%. And as for the pancreatic cancer, the risk also goes very high. This is for both men and women. And for the male carriers, compared to the general public, there is a higher possibility of breast cancer, prostate cancer, melanoma, and other types of cancer. And so the gene test result tells you that you have BRCA1 or BRCA2, then you would be wondering what's going to happen to my treatment, what's going to happen to my future, and you are very confused. You become depressed, and you have all these negative emotions and negative feelings to deal with. And some say, do I have to live with this ticking bomb? Am I given this disease or the cancer that I cannot do anything about? So initially, initially, you would feel these feelings, and that's quite natural. But the more you learn about the cancer, you would learn that there are things that you can actually do. You can manage your health. You can manage the cancer by by follow up treatment, and you can actually begin that earlier than other types of population. You can begin to monitor cancer occurrence. You could also take a very low dose of hormonal drugs. You could also make your daily lives more healthy. And also, it's possible to take a preventive surgery to deal with the cancers. So in the beginning, the people are very confused, but they become more clear now that they are diagnosed with the disease, and they know that they have, for certain, they have the genes. They are now more sure about the direction that they need to take, and also they can reduce the risk through the risk reducing mastectomy. And this RSO actually gets rid of estrogen and thereby reduces the risk of ovarian cancer by about 90%. And it also reduces the breast cancer by quite significantly. So when would be the best time to do RSO? Well, if you don't have the cancer, but you have very likely to have the genes. Well, in those cases, for the BRCA1, you are recommended to do RSO between 35 to 40, and for BRCA2, to do this between the ages of 40 and 45. You have to do your family planning early on so that you can take care of all these things about getting married, having children, and so forth, and then take this surgery for risk reduction. Thanks to Angelina Jolie, people have come to learn about these preventive measures. And that was about 10 years ago. Now there are new information available, and also there have been more experiences by more patients and about these preventive actions or the measures. And so what's really important is that you understand the things related to this surgery and these actions, and then you talk to the healthcare providers to choose the best method that is suitable for you. Once you have the genes, well, you have to consider all these things that I mentioned previously. But if you don't have these genes, well, you just have the same level of risk as the general public. So you just need to maintain healthy lifestyle and then go through the cancer screening program. But if you're going to ask your family members to take the test, then you have to tell them the results of your gene tests. And this is not just limited to Korea, but also to other countries as well. You have the responsibility to tell the family members about the results of the gene test. I mean, this is a private information, so it's up to the person that has received the test to give this information. But here in Korea, people do not want to tell this news because they think this is a bad news, and because this is about flaws. But is it really about flaw, or is it really about bad news? And also, most of the people have found out about the genes because they have been diagnosed with the breast cancer. So they're still in a very difficult situation, still receiving the treatment. So they don't know how to go about telling this to their family members. But they still know they have responsibility to talk about the results of gene testing. And we have done interviews with the patients, and there are 5 different modes of responsibility. And these modes could be different. I mean, different modes are activated depending on who you are talking to, depending on the relationship that you have with the person you're going to talk to. And the first type mode is called the persuader mode. And this is very aggressive mode. You are trying to persuade your family member to do the genetic testing until that person actually receives the testing. And this is according to an interviewee in Switzerland. She said, because if you're not sharing this information, it's irresponsible because it affects them as well. I can't see any reason not to share this information with family members. And there's a huge passion that this shouldn't happen to anybody else, that I can fix this, that this is not going to happen to another woman. I think every woman who's been diagnosed with breast cancer just goes on a mission to save every other woman. And the second type mode is called enabler mode. You provide a lot of information to the family members. You talk about this, but then you're not being really forceful in this mode. And this is according to a Swiss patient. She doesn't have cancer, but she said, but it's important to give this information so that everyone can decide what to do next. And she says, it's not easy. It's not nice. It's not pleasant, but it's quite useful information to know in order to make informed choice and not to say if we had known about this before. And according to this young breast cancer patient from Korea, what she said, my family avoids talking about this. Instead of seeing this as a learning opportunity, they don't want to think of, or hear about this. I think there's a cultural aspect to this. But I want to change how they pursue these mutated genes and see how being a carrier can help them or others to take preventive measures. And a third mode is called relayer mode, and these are simple relay of information, quite neutral, so in a way a little passive. But this is enough to provide opportunity to family members to do with the testing or not. These are Korean breast cancer patients. Well, according to her, she said, I thought it was better to know than not to know. So I just said the same thing. I have the genes, so my mother and my sister might carry it too. So I told them to take care of their health from now on, to get tested if they can. But there's nothing that I can do actively about this. It's up to them to make the decision. Another person said this. I also have a younger brother, so I told him to get this test early on when I found this out. But I don't think he fully knows that I have a BRCA or anything about this. And the fourth and the fifth modes are more a passive mode. And in the layer mode, there's something about feeling guilty, about knowing about in the future that they may have to let people know. And about the decliner mode, there are not that many people that belong to this mode. They would not tell this information to aunts or uncles because this is too much information for them. And also, it's not necessary for them to tell the parents because it would only make them sad without any solutions. So there are these 5 different modes of responsibilities. They have advantages and disadvantages. And if you look at the implications and challenges, persuader and enabler modes are related to autonomy, and also there could be so-called exhaustion of the probands. And about the relayer mode, the information might have been provided to family members, and the family members would not really understand, and therefore there would be lack of urgency, and there also could be indifference. And in terms of the layer and the decliner mode, there could be a loss of opportunity to take the prevention, and then there could also be the possibility of feeling loneliness and the sense of guilt. And so depending on the closeness of the family relationship, and also depending on the life event, and depending on the life situation, and also about the life cycle of the people involved, different modes could be applied. Having the accurate knowledge is what's important. As I said before, we have to know things in order to be able to make the right choices, in order to choose what I can actually do. So what's really important is being open and to have a very flexible attitude. Here, the slide, it says more than just a waiting. And it's not just being being swept away by force of nature. Then you have to thinking about salmon that are swimming backwards in the waters. So you have to change the way you think instead of just trying hard to survive. Just take the things at a time. Just like as Goethe, the German philosopher, has said, just don't hurry. Just take one step at a time, and make choices about cancer of cautiously, and also providing sufficient information to the family members so that they can make the right choices, and also taking the actions by talking to the people that can actually help you, such as the healthcare providers. It's really important to have a healthy lifestyle, and you have to be very stable to be able to help those around you. And you also need to have the uh, the latest information. And to do that, you have to have continuous communication with the healthcare professionals, and you also have to talk to the members of your family. And so it is quite important that you have a constant and continuous communication with the people around you. And you have to find not the best ways, but better ways within the circumstances that are given to you. Thank you for your attention.